Our phone number is 1-800-234-5246. If you have any other questions, you should call right away. But we did have one person call in and want to know. Let's get that question again, make sure I get it right. In what ways do these programs help the families of the troubled teens?
Well, ultimately, we try to come in and, as part of the team, we try to become a family member. And we have money within our program to help, things as far as if the bills need to be paid or if they need, food for the house or pet care. We have money set aside to help with those things and to support the family. I see myself often as a mentor to the youth in the family. So when in my family, it took a person to get me interested in stuff, and that's what we will tend to do, is expose youth to new things, and in a way become a mentor, and hopefully that. And also role model how you work with young people for the family, and work with the family specifically to do behavior management, and to work with schools to do the same thing.
Do you train the parents to do I don't know, what are some of the behavior modification things? Tough love, or what are you teaching the parents?
The parent partners, they have parent groups. And they have those, and they teach the parents different types of interventions that will work with the youth. And also we have, one thing that I'm attracted to is just the case plans, or the client plans that we have, is the goals, the interventions involved that meet the need of the youth that have been diagnosed out of the DSM-IV.
Okay, so how have you evaluated this program? Oh, let's go first to Dr. Michael Clark. Is that from Chico? Do you have a question or a comment?
Yes. First of all, I'd just like to thank you for doing a show on youth. It's so important to get the word out, because there's so many people who are unaware of the struggles and the challenges that our youth face today. And I'm very proud and pleased to tell you that I was one of the people involved in the initial creation of Connecting Circles of Care, and it took a lot of people working really hard late at night and weekends to write a grant and put this together. And Rosalind Usong from Feather River Tribal Health was one of the creators, and it came from the Native American community. They got a planning grant called Circles of Care, and Connecting Circles of Care was a full children's system of care grant. And second of all, I just want to thank all the people, my colleagues and the youth that are there, because it takes a lot of courage to come forward and tell your story like David and some of the other youth have done. So, thank you.
Thank you, Dr. Clark. We appreciate you calling, and it is really brave of you to come and share that. We wanted to give, at the end, we'll give you the website of Connecting Circles of Care. But just a couple more things before we go. You have gone through some evaluation process. You're in about year 3. How do you think you're doing with this innovative, interesting model? What do you think?
I've only been here for a year and a half, close to, and just from what I've heard and what I've experienced so far is the program is growing, and it has improved tremendously. It started out, new, and with new things, it's like, what direction do we go and how do we approach things? But just in this short period of time and the time that I've been with the agency, they've improved tremendously. They've been able to reach out to the communities where other agencies weren't able to, and they were able to connect with youth and different minority populations that other agencies still can't do today.
Very good. Anything else we should know about the evaluation and what you guys have discovered?
It's more or less one of our the lead evaluator, Harold Bays. He supplies every. We have a governance body every month, which basically is just a report of how the program is doing from all the different side committees and all the different counselors. And there's a section set aside for each meeting, and he always has like a dashboard or a data sheet saying how we're doing. and it's always, from my angle, it looks like we're doing good.
I think you're doing good. That's pretty good. Yeah, you must be pretty proud of him, huh?
Yeah, very proud of David. I think he's a great testament to how well the program can work, and he's become quite the young man.
Excellent. And I before we go, we just have a short bit of time left, but this program will run out of money. This SAMHSA funding that you're talking about. Are you trying to find ways for people in Oroville, and that it sounds like some of the communities that you're dealing with don't have a lot of money to sustain this program. Is there other money that you're looking to access, service groups to adopt some of these teams? How are you planning to make this sustainable?
We do have the sustainability committee, and that is something that we is an ongoing thing that we pursue.
So you could use some adoption by some
we can use
service groups or something?
Yes, we sure can.
Sure.
Yeah, I'll take a kid near a liver.
I bet the kids sometimes, you guys, the kids have ideas, right? They're on all these committees. Are the kids coming up with great ideas for keeping this going?
Yes, they come up with ideas all the time.
You guys have any great ideas on how to keep this going? If you were talking to somebody who had a lot of money, what would you tell them to get them to help this program for your community? So it was there for your brothers and sisters and their kids. What would you say? Oh, come on. It's the last 30 seconds of the show. Take it. What do you think?
I will tell them to help us, the community, because it's helping people to change their life and stuff, and stay on track with people that's going to school and stuff like that. Yeah.
Your life's going to be better for it, isn't it?
Yeah.
Yeah. Well, congratulations, and thanks for bringing your whole team here. We appreciate it. We have members from the Hmong team of Connecting Circles of Care. We have a counselor from the African American team and the Rural Mountain team. They get around. And our kids that are all here. Thank you so much for coming. And Lori Dana from Social Marketing. Thanks all for being here.
Thank you. Also, there's a Native American team and the Latino team also.
And I understand it started with the Native American community.
Yes.
So we want to give them the credit that they deserve for starting that. More information at connectingcircles.com for more on this program.
And our unofficial motto is, we will connect with you. I'm really trying to get it to work, but I think that's a really good motto.
We will connect with you?
Yes.
We will connect with you.
I've brought it up several times.
We really got a good thing going. Come on. If you think we're gonna make it, better hang on to yourself.
This concludes the podcast of Health Dialogues, a production of North State Public Radio's KCHO and KFPR. This special presentation is made possible by grants from KQED and the California Endowment.